Good to go with all the camera folks in the room? Yeah? Great. So we have inherited a significant deficit from the previous Stephenson government. It's a $1.6 billion deficit, as Manitobans now know. Whenever you find yourself in this deep of a financial hole, the first thing you have to do is to stop digging. And so that's the message that we're here to share with you today. We have been elected on a series of promises that we've made to you, the people of Manitoba, promises to fix healthcare and to help with affordability by cutting the provincial fuel tax, and we're delivering on these promises. We've been in power just a couple of months since the election, and we're already making good on some of the commitments that we've made to you. And so today, we're here to explain how we're paying for these promises. And clearly, this is something that the last premier didn't do while she was in office. Didn't have a plan to pay for a lot of the promises that were being made. So we're here to send a clear message to the people of Manitoba and also to other people who are watching across Canada that we are serious about being fiscally responsible in our government. We're serious about delivering on election promises that we've given to you. And so here today, we're coming out after sharing that tough news that as of September 30th, under the previous Stephenson government, there was a $1.6 billion deficit, that we are going to implement the cut to the provincial taxes on gasoline and diesel. We are going to invest in expanding hospital capacity, surgical capacity, make other investments to help our society move forward, but we're going to do so without adding to the deficit. In fact, we're working very hard to hold the line. Overall, we're very committed to making things better here in Manitoba. We got to be balanced when it comes to the books in order to do that, but overall, we need a balanced approach that still sees us investing in healthcare, investing in our society, and a balanced approach that also ensures that we can grow the economy, have good jobs, generate more opportunity for people across the province. So our team is taking a balanced approach that's fiscally responsible, but also investing in needed initiatives. So with those few introductory comments, I'll turn things over to the Minister of Finance.
Thank you so much, Premier. As the Premier stated clearly, we of course know we inherited from the previous government a significant deficit, which was $1.6 billion. We know that the last government in their budget had announced an estimated $363 million deficit for this year. In their July Q1 update at the end of July said that that number, $363 million, was going to hold. And then suddenly, 2 months later, here we are with a $1.6 billion deficit figure, which was essentially a $1.2 billion change from what the last government had said in late July. So a big mess and a significant challenge for us as a new government to overcome, but we're working hard to clean up that mess and are already working to ensure we bring some of those out-of-control expenditures back in line, and doing that so that we can deliver on our government's priorities and the priorities of Manitobans. I think one thing that I'm happy to highlight here is some of the changes that we did make on the expenditure side. I know folks are certainly interested in that. We have made some new commitments which are outlined in the document that was released today. We made some new expenditures. One was, of course, the fuel tax holiday. There was also net new health spending and new spending on homelessness to help reduce homelessness in Manitoba. Some very important investments which are in line with our mandate and what Manitobans sent us here to do. We are making those investments, however, with no net new impact on the deficit. And we've done that through expenditure reductions. So we wanted to ensure that as we bring forward our mandate, that ultimately that we're doing that in a responsible way, and that we're ultimately not contributing to that out-of-control fiscal mess the PCs left Manitobans when they left office on October 3rd. So with that, I think I can speak very high level just to some of the expenditure reductions that allowed us to cover costs associated with the new expenditures which have been brought forward since September 30th. I'd like to start by identifying something we've already spoken to, which was the Surgical and Diagnostic Task Force wind down, right? We were able to find approximately $15 million in admin-related savings there. We know, of course, and Manitobans will know that that was a project that saw us sending Manitobans out of country for surgeries, costing significantly higher dollars to deliver those important health services to Manitobans. And as we learned a couple days ago, there was some pretty out of control admin-related costs tied to that surgical and diagnostic task force that are certainly really concerning for any government that's focused on fiscal responsibility. There was also, I'm going to identify some other cost reductions here, $5.8 million lapse. This is related to the delay in immigration of Philippine nurses, some savings there. There was an additional $14 million in healthcare admin savings. There was $16.3 million in PPE from CPGS. The last government was planning on doing some unnecessary stockpiling of PPE that at this point it's been determined is not necessary. There's another $16 million there. And then a $25 million IDEA fund that the last government had brought in that was not subscribed. And ultimately, you know, us as an NDP government, instead of paying civil servants to bring forward ideas, we're actually just going to do the work of engaging with them, talking with them, and having that dialogue about how we can improve services and programs for Manitobans. So I'll just leave it there in terms of some high-level items there. That's just to give a bit of a sense. We're not going to talk about the entire amount, but I can focus on those items. And with that, happy to take questions.
So that's about 75 million of the 123 million that you're projecting to save. Mm-hmm. Where else are you projecting to save 100? The remaining 60 odd, 50 odd million. Where are you projecting to save that?
Yeah, you know, I'm happy to talk about a couple of other items. One, for example, is $32 million from the COVID command center. So there was costs associated with the command center that was wound down to service delivery organizations. $32 million there. You know, myself as the finance minister, I saw that the last government had booked in $2.6 million of costs above budget in finance. We've pulled back some of those expenditures. Those are related to things like conferences and audit fees. So those have been canceled and brought back into department. And of course, as we've already mentioned, the Economic Development Board office, there was some expenditures there for the costs of leasing an office and that were no longer needed as we absorbed the work of EDBS into the Department of Edit, who are now doing that really important work, but we're doing it in-house at a lower cost.
So the COVID command center, you're going to spend 30 million less in one quarter than was budgeted for?
Yeah, there's an estimated $32 million in savings associated with shutting that down.
It was previously wound down, and we're just not having to expend this additional $32 million, just to be clear on the procedural side of it.
So it's 32 million that had been in budget 2023 that is not being spent. It's just not, it wasn't going to be spent, and it's not, so it's not being spent.
Correct. And if I could just build off what the finance minister is saying there. For instance, with the 16.3 million in PPE, that's part of a larger amount that was budgeted. It's just that the demand within that central clearinghouse at Consumer Protection and Government Services is going to be $16.3 million less on the year than what was budgeted for. Right. Keeping in mind that there's a stockpile of PPE with CPGS, the department, but all the service delivery organizations, Shared Health, the regional health authorities, also have their PPE stockpiles. So, yeah, I just want to make clear that we're making these decisions in a responsible way. We're still ensuring that we have the necessary supplies, we have the necessary services to be able to deliver in areas like healthcare to be able to get us through the rest of the fiscal year. But we're identifying areas where we can find some savings and pull things back so that we can make other investments.
Just in that list, Minister, you referenced the PPE saving. Just before then, you mentioned sort of just healthcare. Was that just management?
Yeah, there was some admin-related savings related to duplicative things that the PCs had brought forward. I'm not going to dive into details on that one, but again, more admin-related savings tied to some changes we've made there.
Are they positions? Like, are they jobs that were cut, or what are they?
Well, these are, again, admin-related savings, so related to administrative roles that were being duplicated. And so there was a lot of cost savings there that we were able to find, and that's in addition to the cost savings associated with the surgical and diagnostic task force.
An administrative role within healthcare manager, or is this, are we talking about a person's job type, position, or what is the admin role that you're discussing?
As you might remember from when we've done previous press conferences related to the task force, people who have jobs in the healthcare system that were working in the task force have now been returned to the healthcare system. These savings are additional expenditures that the task force was planning to send out the door that we're pulling back on.
That's right.
That's the healthcare admin is specifically diagnostic surgical recovery task force.
The 15.4 million figure that he shared there is, yes.
Is anyone losing their jobs? Or is anyone unemployed as a result of these savings?
We have dismissed the people who were running the task force, but you've already reported on the nature of their work situation.
I think I have this right in my notes. It was 14 million in healthcare administration. That was an additional to the 15 million DSRT savings.
Mm-hmm. That's
okay,
right.
So 14 million healthcare administration. That is task force or other healthcare administrative roles.
These are efficiencies that were identified. These are things that were set out in the budget that we don't have a staff position or an initiative where we have to spend this money now. So we're just returning that, in this case, $14 million, back to government to use for other initiatives, like adding surgical slates at some of the hospitals, like expanding beds at the Grace.
So a 14 million reduction in healthcare administration roles doesn't mean that anybody lost their job. The DSRT that we talked about is its own $15 million line.
Yeah.
The 14 million one isn't affecting any job positions in
Correct.
healthcare.
We're investing in healthcare. Yeah.
There's around 5 million for delayed immigration of Filipino.
5.8.
5.8, yeah. Can you elaborate on that? Like, what savings did we generate? Just, I guess, not as many people came over as expected.
Very few people have come to Manitoba through this program that was announced. And as a result, the cost of paying these folks, but also the cost of getting them set up, is not something that we're going to have to spend money on this year. We do clearly need more people to work in the healthcare system, but the first step for our government is to get these people into Manitoba. That was not happening under the previous government. And so as a result of us needing more time to get these folks into Manitoba because of the lack of progress on this announcement, here's the amount that we're able to save.
Are there any plans to continue the program because there's a lot of people participating?
Well, what I would say is that where we have already developed a relationship with certain potential healthcare workers from the Philippines, we're definitely going to lean in to try and make sure that those folks can make their way to Manitoba. But we're not going to double down on the same approach that the PCs took. We are going to cast a wider net. Of course, education and retention are going to be important components of that, but we're also going to be looking at other places around the globe where we could potentially be recruiting staff from.
So that particular program, there could be a possibility that it could be just stopped, just suspended.
Well, this was sort of, I'm going to explain a little bit just so I can kind of answer your question more fulsomely. This was sort of a limited initiative insofar as it targeted this roughly 300 person potential workforce, right? The progress made on this by the time the election rolled around in Manitoba was close to zero in terms of bringing people into Manitoba. Some people did come, but it's a very, very low number. As a result, we will continue where there's been letters of offer and relationships made, people are entering the immigration stream to Manitoba. We're going to continue working with those folks because we do need people to work at the bedside in Manitoba. Going forward, though, it's not like this is an ongoing program where we're going to continue to need to re-up it each year. We're going to continue investing and trying to cultivate those folks who are already in that stream, and then we're going to be looking at other sources as well for the future.
What about the candidates who've been given a job offer but maybe they haven't opened an immigration file yet? Is that they're still welcome to
Yes. Sure, and not only welcome, but we will be actively following up to try and get people here in the future.
Beyond the job offers that have been made, you're not looking at going back and recruiting from that pool.
We will be looking at doing more recruitment. all over the place.
Okay. But what you're saying is with this particular program, recruitment program in the Philippines, is that you're not going back and re-upping it, right? So
Meaning, in the next year's budget, we're not intending to take another trip. Right. If hopefully that helps to clarify.
Recruiting elsewhere mean a new international recruiting trip? Because there are concerns that, you know, these countries have maybe even less healthcare workers and that we're going and trying to poach some of theirs. So is your government going to pursue international recruiting trips?
International medical graduates, international educated nurses are going to be part of the staffing strategy to deal with the healthcare crisis in Manitoba. We're going to be balancing considerations like the one that you've laid out there. But of course, we have to respect free will and people's ability to choose their own destinies. And of course, you know, we're going to work hard to pursue all of this in a way that invests in healthcare in Manitoba.
Is there a recruiting trip, I guess? Because that's
I have
another
no
one.
news to announce on a specific recruiting trip other than to just shed light as we are going to continue to try and recruit folks from abroad to work at the bedside in Manitoba.
Larger than expected deficit here was collective agreements that were reached in healthcare. Unexpected costs there. Now that you're in charge of the books and you've put out the second quarter report, does this take into account potential increases from collective agreements such as the civil service one that's currently in negotiations?
Yes, it does.
So you've set aside money here for settling that collective agreement?
And it's inclusive of the MPI settlement as well.
That's right.
There's a letter set to go out, signed by MGE, MFL, other labor groups, the Canadian Centre for Policy Alternatives, asking you to stop your planned tax cuts, Mr. Premier. They're worried, they're seeing the $1.6 billion number.
It's a real number.
Yeah, they're seeing that number, they're worried about it, and they're saying the taxes only benefit, they don't benefit low-income people. Are you still planning on moving ahead with your plans on taxes?
We're not making any news here today in terms of anything like that. We're talking about when we found this huge fiscal hole, step one, stop digging. That helps everybody, including workers. It helps you as a Manitoban to know that you have a government that's being fiscally responsible and we're actually doing the serious work of grappling with this issue so that you have confidence in our administration. But it helps workers too, because if we want public services to be sustainable in the long run, they have to be financially sustainable. And so I think that, what we're doing here today is we're sending this clear message that we're holding the line. We inherited a $1.6 billion deficit from the Stephenson government, and now we're holding the line through the rest of the fiscal year while delivering on some key election promises, like reducing the fuel tax, like investing in healthcare. And we're doing this so that we can honor our commitments, but also take a balanced approach when it comes to fiscal responsibility.
You have no plans to reverse any of your plans on fuel tax cut or anything else like that?
Fuel tax cut is taking effect on January 1st.
And the other tax cuts you've promised, like income tax, those are going ahead despite the $1.6 billion deficit?
Well, those are legislated at this point and will take effect on January 1st where that date applies. You know, that doesn't apply to all of the things that we're necessarily discussing here. But I think it's important that as part of a balanced approach where we invest in healthcare, we're balanced with the books, that we're also offering predictability. Because you have households who've made their financial decisions for the coming year, and we can't pull the rug out from underneath you after you've already begun your financial planning for the next fiscal year. You got businesses who are making hiring decisions, they're sending offers to people out of province, trying to recruit them to come here to Manitoba. We have to be responsible and balanced and move with a steady hand here. And so what we're saying here today is that all the fiscal framework that you've previously heard from us, that is remaining in place. And as a result of this much larger than anticipated deficit we've inherited from the outgoing Stephenson government, here are the ways that are very tangible and measurable that we are going to deliver on our promises with a plan to pay for them.
You promised to hold the line on the deficit here, but you're not reducing the deficit, and it is very high, as you stated. Why not use some of these savings towards slaying that deficit?
Well, again, we were left a significant mess by the previous government, this $1.6 billion deficit number. As the Premier said, our focus is going to be to hold the line. If we were to have allowed the spending pattern that had been in place under the last government to continue, this deficit number would have been far, far north of 2.5. It would have been really, really up there. So we are going to be focused from now to the end of the fiscal on holding the line. And we're doing that not only through the work that we've already done, which we've outlined, some of which we've outlined, but we're also doing financial reviews, especially of those areas of government where we're seeing variances or we're seeing over budget. We're also reviewing capital projects to ensure they're in line with our government's focus and our mandate. And so this work is ongoing. We're going to continue doing this work with the goal of continuing to hold the line and ensure that we correct the fiscal mess that had been created by the previous government.
The letter issued today by CCP and some unions also asks you to reconsider the 4-year timeframe for returning to balance, given that you're starting at 1.6. Are you still committed to balancing within the term, and how do you get there?
We've got no plans to change anything that we've announced previously, to share any news like that with you here today. What we're saying is the new piece of information that we have is that we've inherited a $1.6 billion deficit from the Stephenson government. And now, because this is a structural deficit, it's going to take active work for the rest of the year just to hold the line. Right? There was a trajectory created under the Stephenson administration that drove this deficit to 1.6 billion as of September 30th and would have continued to further grow the deficit over the rest of the fiscal year. Step one, we're holding the line. Step two, we're finding efficiencies within government so that we can cut the fuel tax to help you out after the holidays, so that we can invest in your healthcare at sites like the Grace and Brandon and Selkirk and other important facilities right across the province. So this is an in-year update that we're providing here, and I think it's an important one just to signal our seriousness about being fiscally responsible, while of course having a balanced approach that still invests in the economy and healthcare.
Donc si je comprends bien, en fait, ce que vous dites, c'est que vous n'allez pas faire d'autres dépenses. Vous allez prendre l'argent qui était probablement déjà là, mais mal calculé pour des dépenses qui n'étaient probablement pas efficaces, et le rediriger autrement, parce que si vous dites vous ne creusez plus, donc vous ne faites pas de dépenses et vous ne faites pas nécessairement d'investissement nécessairement, je ne comprends pas. Quand vous dites de manière responsable et efficace, comment vous allez faire ça sans qu'il y ait plus de dépenses et que le trou ne continue pas à descendre?
Parce que nous avons identifié les parties dans le plan de l'ancien gouvernement qui créera même une situation plus pire. Puis, nous sommes en train de guérir cette situation-là. Puis, en même temps, il y a 123 millions de dollars de nouvelles choses que nous voudrions faire de maintenant jusqu'au mois de mars. Et puis, alors, en même temps, nous avons trouvé 123 millions de dollars d'endroits dans le gouvernement où ce que nous pourrons peut-être éviter de dépenser cet argent.
Donc, si vous êtes confiant dans le plan que vous avez, est-ce qu'on peut se dire qu'en mars, peut-être le déficit aura diminué ou sera toujours à la même place?
Nous sommes ici aujourd'hui pour présenter l'information de notre travail jusqu'à maintenant. C'est une période très importante parce que l'ancien gouvernement était en train de ne pas partager cette information avec la province. Et pour nous, c'est très important d'avancer un plan responsable, mais en même temps de partager cette information avec tout le monde dans notre province.
For your expenditure management plans, it says here these measures will result in further expenditure reductions and potentially a lower net deficit. Have you set a target for how much you want to see expenditures reduced by? Have you set a target, a dollar amount for that?
We're here to share information that's contained in the document. We invited journalists who are your eyes and ears into government to have a technical briefing with finance officials. They're invited to ask any question that they wanted, to be able to share the most accurate information with you. And so at the end of this process, with all this information being put before you, the people of Manitoba, I think that we can say that we're taking steps to restore fiscal responsibility at the provincial level, while at the same time investing in healthcare and helping to make life a little bit more affordable after the holidays.
Are there any concerns?
Sorry, I'm just going to interrupt there because the hand means we got to go to Zoom for a couple questions. If we could just hold the question for one moment, please.
Thank you, Premier. From Brandon, we have the Brandon son, Colin Slark. Colin, your one question, one follow-up, sir. Go ahead.
Good afternoon. With yesterday, Minister Glenn Simard giving a new mandate letter to the new MBLL board, asking for an expansion to end the freeze on gaming expansions and to expand public liquor store options. How much of that decision was motivated by your government's need to increase revenues?
I think the primary decision was made by a desire to advance economic reconciliation in Manitoba. It's been a long-standing area of contention with the previous government and First Nations, and it is a request that we've heard that when we look at potential future opportunities like Nawayo-Tena or other urban economic development zones, such as some of the ones that you have in Brandon, that there at least be a conversation around whether there be gaming opportunities at those sites. And so we've taken a look at the current situation. There was a pause in effect for multiple years under the previous government. The province has grown quite a bit since then. And so as part of an overall strategy to advance economic reconciliation and, of course, the overall economic development of the province, we took the decision that, you know what, we can lift this pause while still ensuring that we're being socially responsible with liquor and lotteries.
Did you have a follow-up, Colin?
I do, thank you. Given that we're reaching that beginning of the year when municipalities and school divisions are going through their budgeting process, and with this $1.6 billion anticipated deficit, what have you told those municipalities and school divisions about what they should expect in terms of funding increases, or what that will be like, since the province itself is in a bit of a hole right now?
I think the way that we solve a challenge of this magnitude is by working together. And our team has a lot of respect for the expertise of municipal leaders, for elected school division trustees, and we'd like to work together on the situation. And so when it comes to the divisions, that school funding announcement will come in the new year. When it comes to the municipalities, I believe you were in the room when we shared the message with them, which is that the idea of a municipal funding freeze is over. And part of that is what we're talking about here in this fiscal update as being a balanced approach. We have to wrangle this deficit while still investing in necessary services like healthcare and setting the stage for economic growth. That's a balanced approach. So again, if we don't invest in healthcare, then it's going to be a false economy that we're finding. If we don't invest in economic growth, we're not going to be able to say that we really explored all options in terms of addressing the current fiscal challenge. And of course, there is, as we're outlining here, an important component of this, which is being responsible and doing that belt tightening at the government level to ensure that we're being responsible. And so we're very committed to a balanced approach. And as part of that, we will be inviting municipal leaders and other, stakeholders in the community in for financial briefings similar to the one that we offered here at the Ledge today. And then, of course, the follow-up step from that is to say, here's the challenge that we have. We do need to invest to continue to grow our province and our economy. Now let's work together and find some creative, maybe innovative approaches that are operable and we can stand up within the current financial environment, but are still going to be able to support your communities or support the needs that we have to deliver to serve the people of Manitoba. So really looking forward to some help and collaboration with a lot of the trusted partners we have across the province.
On the gambling Okay, that's all we have on Zoom. We'll turn it back to the news conference.
Sorry, can we just go back to the question that was waiting, and then we can go to the gambling follow-up?
I was just wondering, are there any concerns going into the holiday season with drop potentially with any corporate income taxes or even people just not spending enough money that could mean less revenue for the government?
Well, of course, we want to see tax revenues continue to go up. As we reported recently, the most recent estimate by CRA was that we were going to see a reduction from what had been budgeted, which creates additional challenges. We are going to learn more in mid-January about changes to that, if there are any, from CRA, and that'll give us a better sense of the direction of that. But of course, again, those revenues are important in helping us to deliver on what we need to deliver on.
I guess, are there any plans in place right now if those revenues are even lower than expected?
Well, it's a hypothetical. Yeah. We got our hands full dealing with the very real challenge of $1.6 billion deficits that was handed to us by the previous government. So maybe we'll keep our comments to these very real challenges before we game out all the hypotheticals.
On the gambling question, First Nations groups were shut out of establishing a casino in Winnipeg. They wanted to for years. Previous governments had said no. Then there was the pause on new gaming infrastructure. There was a lawsuit launched by the AMC against the government. Are you looking to allow First Nations to establish a casino in Winnipeg?
We're looking to have a conversation. We don't have a specific proposal in front of us, but what we're saying is that we're open to working together on economic reconciliation. And if that includes a future proposal from the Nawayo-Tena site or other urban Indigenous economic development zones around the province, we'll certainly consider it. And if we can move forward in those areas in a way that's socially responsible, like we got to keep in mind, liquor and lotteries deals with activities and substances that cause addictions in the province, or are interrelated with addictions, is perhaps a more accurate way to say it. Then I think there's going to be an openness to engage. So at this stage, we don't have a specific outlined plan to move forward with. What we've heard, though, is that there's an interest. And so we're setting the preconditions for a conversation to happen within that overall framework of let's be responsible to our society here when it comes to gambling, when it comes to liquor. And I would say that social responsibility framework is something we take very seriously on our team. And I think you see it reflected throughout the mandate letter. Lifting the pause, for sure, there's going to be big interest in that. But also, look at the prevalence of online gambling ads that we see right now. Most of that money going out of province, and at best, a gray market type situation. What's the responsible path forward there? Particularly with young people and people who like to watch sports. Liquor sales, again, there's a Costco, I understand, going up in Headingley. Be great to have a liquor mart type location near that Costco in Headingley. So there does need to be some expansion, but how do we do that in a responsible way for the people of Manitoba to have confidence that, yes, we're doing some economic development activity here, but it's still going to take care of the social side of things here in Manitoba.
Why not let Costco sell it, Mr. Premier?
Because we need to look at that economic development side. And I think liquor and lotteries has shown that they are an effective generator of revenue for government. But crucially, it has to be done in a socially responsible way.
You mentioned urban Indigenous economic zones for a potential casino. Yeah. You wouldn't envision one smack downtown or anything. Right now, there's 2 casinos in the city and the outlying areas, but
yeah, we don't have a specific proposal in front of us. Yeah. So it's not really about what we envision. It's more, it would be led by a proponent, somebody like, whether it's Treaty 1 or a Westman First Nation, if we're talking about, that part of the province, they would have to come forward and say, all right, here's a plan, and then we take it from there.
Est-ce que vous pourriez, s'il vous plaît, répéter ce que vous avez dit par rapport à la manière de gérer la situation de manière responsable lorsque vous avez parlé d'investir dans le système de santé, mais aussi d'être aussi près des municipalités?
Oui, bien, c'est un grand défi. 1,6 milliard de dollars, c'est un grand défi. Et une des manières qu'on pourrait guérir cette situation est de travailler ensemble avec nos partenaires dans la communauté, soit les divisions scolaires, soit les municipalités. Alors, c'est la première étape que nous avons trouvé des solutions pour cette année maintenant, mais il y a aussi beaucoup de travail pour qu'on invitera les autres partenaires de contribuer leurs idées. Alors peut-être on pourrait trouver une façon d'investir dans l'économie, d'investir dans le système de santé, trouver des endroits où on pourrait peut-être épargner de l'argent avec le gouvernement. Et puis, dans une méthode ou dans une manière balancée, qu'on pourrait guérir ce défi dans cette manière-là.
Just back on this document here, with the expenditure management program, has your government set a target, a dollar figure that you want to see spending reduced by at these overexpending organizations?
Yeah, go ahead. I'm happy to jump in as well.
As we said earlier, the goal right now is to hold that line. So that we were on this trajectory that the previous government had put us on. They left us with this $1.6 billion number. Our focus right now is going to be to make sure we hold that line and do everything we can through expenditure management, through the measures identified here, cost reviews, capital reviews, to keep that in check. The number specifically, we don't have one. It's about holding the line and making sure that we do everything we can to not allow those expenditures to continue to go the direction the last government had sent us in. And so that's going to be a lot of hard work. We've been doing that hard work together as a team, and that work's going to continue.
Besides healthcare, what are the other organizations that are forecasting over expenditures, and what are you asking them to do besides healthcare?
Well, hydro is far and away the biggest issue that we have.
Mm-hmm.
Okay. And so have you asked Hydro to do anything specific? I mean, it's hard to control the rain, so.
But was it responsible to count on close to $500 million in net income from hydro when you were designing the 2023 budget? I think that's an important consideration for the province.
So what does that mean for your government? Are you asking Hydro to go back and review its budgeting processes or its forecasting, or to be more conservative in its forecasting in the future?
I look forward to the new hydro board putting their mark on things, and I have a lot of confidence in the people we've appointed and are looking forward to working with, that they will be responsible when it comes to the finances of this most important crown corporation.
Any other organizations that you're asking to do some belt tightening besides healthcare, which we've seen the expenditures, the higher expenditures than budgeted, hydro, any other organizations that you're looking at?
I mean, I think right now we've identified that there's some over expenditures, especially in health, that we've seen, but elsewhere. Won't identify those today specifically, but we can say where we're seeing that. That's obviously where we're going to want to zero in to do some reviews and understand better what's happening in those particular areas. But won't comment further today on which specific areas we're referencing.
Within that answer, if we can drill down on healthcare, though, I do think there's stuff that is the responsibility of the provincial government that didn't happen this year. There was not an adequate budgeting for what the collective agreements were going to come in at in budget 2023. There wasn't an adequate budgeting for the impact of inflation on supplies and other medical expenses within the provincial health service delivery organizations. So that's why I say budget 2023, the more we get into this fiscal year, surprise, there's a $1.6 billion deficit. The further we get into the fiscal year, the more we see that budget 2023 was wishful thinking. And if you don't account for inflation at a period of generationally high inflation when it comes to the supplies you have to buy, not just in health, but also for construction and infrastructure, when you don't budget for collective agreements to come in at a realistic level, when everyone knows that people are going to be asking for a wage increase, that's irresponsible. And that's what the previous government was practicing. Not just when they brought in budget 2023, where definitely they were being irresponsible, but also through the fiscal year. In the 6 months where they were managing things, and they set us on a course to continue to go over in a lot of different areas.
The government set aside a contingency fund, and I get it from the documentation, you feel it was not enough, $500 million to deal in part with the collective agreements that were reached. Given that you were counting on those contingency funds for some of your campaign promises, and now those contingency funds are used up pretty much, what does that mean for your campaign promises?
Within the current year, for us to deliver on our campaign promises means being responsible. And any dollar we want to spend, we have to find as a savings in another area. And so today we've outlined a number of areas where we're able to pull back expenses without impacting on services, and that's allowing us to cut the provincial fuel tax on January 1st. That's allowing us to invest in more hospital beds at the sites that have emergency rooms around the province, to invest in discharging patients on the weekend, to invest in more surgeries here in Manitoba. So we were campaigning on the expectation that we could trust the numbers the Stephenson government shared in Budget 2023. We now see that that outgoing administration was not being straight up. And so we're resetting the relationship with you, the people of Manitoba. We're going to be transparent. We're going to provide these updates. And most importantly, we're just going to get things back to a more responsible approach. And this balanced approach that we're talking about, being a balanced approach means investing in healthcare and other important services to help you and your family. It means growing the economy, and it means doing a lot of hard work behind the scenes in the Ministry of Finance, at Treasury Board, throughout government departments to find ways where we can save money without really impacting you, the people of Manitoba.
I'd like to just build on that. If I could just, the Premier mentioned this, but the lack of transparency that we saw from the last government, we've talked about this before, but it does bear repeating. The enabling appropriations line, the ISA line, which is where those costs associated with those collective agreements were supposed to be taken out of. The last government had settled those agreements prior to their last quarterly update at the end of July. And yet they were not reflected for Manitobans in the numbers, which created a more favorable sense of our overall fiscal situation than was actually in place. That's what Manitobans have been dealing with. And so really what happened there was those collective agreement settlements that ended up being applied against that enabling appropriations line, almost wiped that, which was for contingencies, wiped that clean. The cupboards were bare when we got in there. And so to the Premier's point, we've had to do this hard work to make sure we can advance our priorities. We're doing that work. We found those dollars as has been outlined. But that's the situation we faced when we got in. And again, Manitobans were never told that going into an election. They were given a false sense of our overall fiscal situation. And as the Premier mentioned, so were we. And we went in trusting that budget and that the numbers were going to be accurate. And as it turns out, they weren't.
So are you still committed to getting to a balanced budget in 4 years if we're still dealing with a $1.6 billion deficit projection at this point, which may be updated third quarter? You can go from 1.6 in the red to 0 in 4 years while offering raises to the public sector and investing in healthcare, et cetera?
We're going to take a balanced approach. You know, we're not changing anything in terms of those comments that we've made up till now. The thing that we're outlining is that the biggest change we've inherited is this $1.6 billion deficit. And so what that means is in order for us to start delivering on our promises, we have to find savings right away. And so we're starting to do that in a very responsible way. The Minister of Finance just talked about enabling appropriations, which I believe was 949 million, 948 million, just shy of 949 in the budget. When we came into office, the previous government had oversubscribed that. The amount that they were looking to spend in that area was north of $1 billion. So when we're talking about holding the line, it means we had to find like $100 million in savings just to hold the line. And then now another 123 million, you know what I mean, in order to be able to pursue these initiatives. So really, this is a significant fiscal situation that the Stephenson government left the people of Manitoba. We're hard at work to clean it up. First step is just to communicate, when we're in a hole this deep, we're going to stop digging, and we're going to start investing in you.
Let's go back to an earlier question there.
Your department has canceled conferences and other kind of, I guess, discretionary spending. Is that the message going out to all the departments that conferences are not to, we're not sending people to conferences,
No.
We're not taking discretionary?
No, it is not.
What's happening at the departmental level to rein in expenditures?
We have to work with the civil service who are professional, hardworking Manitobans to deliver the things that we want to do in healthcare, to be able to deliver savings when you go to the pump. And we don't think it's fair if there's a deficit being driven by the service delivery organizations in healthcare to ask the staff in the Department of Agriculture to give up on professional development or a holiday party and things like that. So again, taking a balanced approach means recognizing the areas where we have to take action, but also continuing to invest in the areas that are going to help us continue to grow the economy and benefit our society in the future.
So does that mean conferences for folks at WRHA, Prairie Mountain Health, maybe Crown Corps are not part of the mix going forward?
I would say that we have an expectation that if you've missed your budget by hundreds of millions of dollars, then senior executives will be very judicious with their spending. And I'm sure we will have more information to share about that, but I think you saw that reflected in the mandate letter to Hydro.
Okay, I do want to go back to, because you're holding the line on the deficit. You could, though, take some of that savings and reduce that deficit. You could put some into reserves. Why is that not an option?
The previous government should have done this. The previous government had a windfall of $1 billion nearly fall into their lap. And they used it to go try and buy favor in the lead up to an election. What we're doing here, like you look at the chart, there's this massive deficit like this. We're talking about trying to make people's life better by doing, marginal changes here and there so we can invest in healthcare and so that we can invest in making your life more affordable. But the fundamental accountability question has to be for former Premier Stephenson, why did she budget on a windfall year and create a new structural deficit that now we're going to have to make some serious decisions about going forward? The answer that we have, we're fiscally responsible, and you can see that within our first few months in government with a balanced approach. We're investing in our commitments to fix healthcare and to make your life more affordable by finding savings within government, being fiscally responsible, and we're starting to get a handle on this deficit that we've inherited by holding the line.
What do you tell the credit rating agencies who don't like the word structural deficit and a higher, much higher than expected deficit?
Yeah. Well, first of all, I would note that we have seen some updates from, I believe, Scotiabank. And what we've seen from these sources so far is that they're taking note of the situation. But again, today's exercise is an important step towards reassuring Manitobans first and foremost, but also credit rating agencies, that we are fiscally responsible. And so we're going to take a balanced approach that sees us continuing to invest. We're going to grow the economy. We're going to tighten the belts internally. But as part of that, we are building credibility, it is our hope, with you, the people of Manitoba, but also the people who watch our economy, and laying out a path to restoring fiscal responsibility here in Manitoba.
Any update on the MNP review? Is that done yet? Still underway?
Work underway and more to come on that, but we will be releasing that publicly when it's available.
Great.
Thank you.
Thanks so much, everybody. Really appreciate your time. Thanks, folks.